Hello, welcome everybody to today's session. My name is Donna Morgan. I'm the Math and Terminologist for SNOMED International, and I'm the moderator for this section. The stream that we're looking at today is demonstrating implementation excellence. We have two speakers, and so we're running a concurrent session. Firstly, we've got Natasha Krul from the Netherlands, and her presentation is titled The Importance of Patient-Friendly Terms in the Netherlands. And she will then be followed by Mariana Meira from Portugal, and she's working for SPMS. Her title presentation is Multilingual Mobile Application and Practical Uses within SNOMED CT. Please remember you can submit your questions at any point, and I hope you enjoy those presentations. Thank you.
Hello, welcome to my presentation. I'm going to present something on the importance of patient-friendly terms in the Netherlands extension. My name is Natasha Krul. I'm an advisor, medical terminologist with NICTIS, and my colleague Tim Volkert is also on the call for also available for questions. He is a manager of terminologies and the SNOMED NRC. We both work for NICTIS. NICTIS is an independent national competence center for electronic exchange of health and care information. And our activities include the development and management of information standards. And we are also the National Release Center for SNOMED in the Netherlands. So the key message I would like to get across basically is that SNOMED enables communication in a patient-friendly way, which leads to better understanding by patients. And when I refer to patient in this slide, but also in the next few slides of this presentation, I mean the patient, him or herself, but I also mean the support system of the patient. So that could be family, friends, neighbors, caregivers. So that's something important to remember. So why is it important to have patient-friendly terms? Well, there is a language barrier between medical terms and layman terms in general. But in Dutch language, we see that this barrier is actually even bigger because medical terms, especially anatomy terms, are based on Latin. And if you compare Dutch and English language, then you would see that English language also uses quite a lot of Latin, especially in the anatomy. But in Dutch language, it's not like that at all. So for Dutch anatomy terms, the word is completely different compared to a medical anatomy term. So that's why the barrier is bigger in Dutch language. And a lot of research has been done. In my notes, I've included some sources, some research studies, if you care to have a look at that later on. But a lot of research has been done in the communication between patients and healthcare professionals. And we've seen that they all come to a sort of like a same kind of conclusion, that there has to be mutual understanding between patients and their healthcare professionals. And it also reduces the number of times a healthcare professional has to explain or repeat the information. There's also language unification. So for instance, a patient who sees a nephrologist, a cardiologist, a pulmonary doctor, if all those healthcare professionals use the same patient-friendly terms for the conditions that patient has, you can see that it reduces the amount of stress with this patient. They feel more at ease, they feel more in control. They are able to ask better questions because they have a better understanding of what is actually wrong with them. And they also are able to evaluate the pros and the cons of a certain treatment. So we think that better communication in a patient-friendly way leads to better understanding of medical condition. Some important stakeholders are patients, representatives, patient federations and organizations. They're actually the consumers of these patient-friendly terms. They're sort of like the connection between the healthcare professional and the patient. And they need these terms to be able to communicate with patients, to inform them, and also to stand up for their patients' rights. And it all helps if you have these patient-friendly terms. Content developers are also very important stakeholders. There are many different organizations that create patient-friendly terms, and they all have different objectives. So, for instance, we have an organization, and they are specifically for people with a lower education or foreign people who don't have Dutch as their first language. And there are also organizations like Thesaurus-Zorg en Welzijn, and they create patient-friendly terms for certain websites with patient information, information folders. So they are also very important stakeholders. Then obviously the healthcare institutions and the hospitals, they need their patient-friendly terms in their portals to be able to communicate with patients. Then there are the EHR vendors. They need to adapt their software to be able to show patient-friendly terms in the portals. And then the healthcare professionals are also an important stakeholder, but we're not sure they are aware yet of the possibilities and the benefits of these patient-friendly terms, because we haven't really had any request from them that they need these patient-friendly terms, but they are an important stakeholder. So how do we do it? This is the NICTIS SNOMED browser, and currently we are working on a very big translation project in which we are translating the relevant part of SNOMED into Dutch. And we have a certain language reference set for that. And for the patient-friendly terms, we have added a second language reference set. So for example, this arterial structure, we have two terms for it, two translations. First, this is this blue symbol, the medical symbol. I'm not really sure how you call it in English, but it's like a sort of a snake on a stick. And the medical term for artery or arterial structure is arterie. That is the medical term. That's how a doctor would put it in his EHR. And then there's this green. It's supposed to be a patient with a head and a body, but a lot of people see it as a keyhole. But then this patient-friendly term, slagader, which is the term that people would refer it to in layman's terms. And for most patient-friendly terms, we also have patient-friendly descriptions. That is this, and it could help to explain what this structure is. So if somebody doesn't understand the word slagader, then they could always read the description, and that might help in understanding what is meant. So I have some more examples. Pneumonia, for instance. Pneumonia does not have a patient-friendly description. Alopecia has a patient-friendly description. But abscess, for instance, here you can see that abscess, the medical term for abscess and the patient-friendly term for abscess are both the same. So in this case, there is no patient-friendlier term than abscess. So in that case, we add abscess as a patient-friendly term in the second language reference set, even though it's the same as the medical term. I also wanted to show you a quick demonstration. The man in the blue shirt is the general practitioner. The lady in the pink dress is the patient, and this is a lady, the healthcare professional in the hospital. So SNOMED is basically the dictionary behind all these terms that will appear. So for this is the Dutch medical term for cancer in the stomach. And you can see it's also mapped automatically to ICD-10, which is used for billing in hospitals. And then the general practitioner would see this term, and the patient would see this. So you have three different terms, three different wordings for the same SNOMED concept. I also would like to introduce a research. Hugo van Mens, he is a PhD candidate for medical informatics at the Amsterdam University Medical Center, and he uses SNOMED, the hierarchy and the definitions of SNOMED to clarify certain SNOMED CT concepts. So in this first example, you can see a term that does not have a patient-friendly term. So to be able to describe this term, he uses the hierarchy of SNOMED to explain that agranulocytosis is a kind of immune system disorder. So the same also for this term, it has 3 parents, so he uses the hierarchy to explain that this term is a type of immune system disorder, skin disorder, and disorder of a cardiovascular system. So basically, you do not need a patient-friendly term for every single SNOMED term, but you could use the hierarchy of SNOMED. The second example, he uses the definition. So it's sort of like a post-coordination. If you have a patient-friendly term for the pancreatic structure and you have a patient-friendly term for the primary malignant neoplasm, then you can combine these two to create a patient-friendly term for this SNOMED concept. Because SNOMED contains a lot of knowledge, and in his research, he uses that to create patient-friendly terms. I've included a slide with his contact details, so feel free to contact him if you have any questions or are interested in any other way. Just a quick note on the obstacles. What we could basically say is that it's very difficult to establish which term is best to use, because patients have different levels of understanding. There's differences between education, there's differences in understanding of the language. So what we've said is we use B1 level. B1 level is by the Common European Framework of Reference for Languages, and that can serve the majority of the Dutch population. We've also seen that implementing the hierarchy of SNOMED is quite a challenge for EHR vendors, but actually necessary, because then you can use the hierarchy of SNOMED and the knowledge that is in SNOMED to create patient-friendly terms. So you for 30 neoplasms of the stomach, you just need one patient-friendly term, because you can say all these 30 are a kind of cancer in the stomach. So to conclude my presentation, I would like to say that despite the obstacles, we're convinced that adding patient-friendly terms to the Netherlands extension is a great opportunity to communicate with patients in an understandable way, and it also creates the possibility for EHR vendors to show the appropriate term to a patient. So I'm going to skip this slide with questions, because Mariana is going to present her presentation next. And after she has finished, then you have the possibility to ask questions. Thank you very much.
So, hello, and thank you, Natasha, for such a clear presentation. My name is Mariana Meira, and I will be presenting a practical use case relative to the Portuguese mHealth application. The main goals of this session are the analysis of patient-driven semantics via SNOMED CT and the importance of clinical terminologies to the existence of consistent health electronic records that are actually accessible by the citizen himself. So I consider it is important to refer. I am here on behalf of the Portuguese Ministry of Health, namely the Shared Services, SPMS, which is the entity that is responsible for the technical implementation of information systems within our health cluster. In parallel, and aiming to optimize and to rationalize the procurement of goods and services within the Portuguese health system, we are also responsible for central purchases, financial services, and human resources. In terms of numbers, this is applicable to a population of approximately 10 million citizens and a universe of 54 public hospitals and about 350 primary care units, of which 90% operate under SPMS software. Aligned with this, it is also relevant to mention our national health strategy, which is citizens-focused and sustained by principles such as accessibility, simplicity, and continuous improvement, always aiming to provide our citizen with support in achieving its health goals and to promote his proximity to our health system. So, with this in mind, we have decided to create a mobile application that gathers the patient's information regarding its health and that can be used anywhere and anytime. It is called My NHS Wallet, and it was first launched in January 2017. So here, yes, we can see here, and according to the operating system, the number of downloads of our mobile application, which is available in both the App Store and the Play Store. This app requires authentication, and therefore it will retrieve specific data according to the end user that is authenticated. Built according to the citizen's interest, it gathers the patient's information in its smartphone or tablet, organized in the form of cards, and that is why it is called My NHS Wallet. Each card will then correspond to a typology of health information, and the citizen has the autonomy to decide which cards he wants to have and to carry in his wallet. At this moment, we have about 10 health cards available to our patients, namely the Health Access Data Card, Prescription Card, the Living Will, Immunization or Vaccination Record, the Allergies Card, Rare Diseases, Physical Activity, and a set of health measurements too. Challenges and solutions. So, taking into account that the citizen's health data is spread over local and central software within the public and private sector and under multiple property, there is a clear difficulty to collect and to present all of this information in a structured and uniform way. Regarding this point, the application of standards such as SNOMED CT consists on a guarantee that the data that is collected among multiple health systems and interaction presents a reliable level of consistency and actually improves the safety and the quality of our patients' care. To be a bit more quick, and considering the practical use case of SNOMED CT employment, we currently have 2 health cards that were built with resource to this terminology, namely the vaccination or immunization card and the allergies card. In addition to this, and aiming to maximize the usage and the benefits of this terminology, we are currently working on the translation of our health cards. At this moment, we already have a bilingual immunization record available to our patients, and we are working on the translation of the allergies cards with resource to the SNOMED CT catalog. Here on the right of the screen, you can take a look at the functioning of this feature in our mobile application, viewing the translation from Portuguese to English and backwards of citizens' immunization record. In terms of next steps, and also to conclude this presentation, we also aim to translate our allergies cards to English and then to expand the options of translation according to the existing SNOMED catalogs. So, thank you very much for your attention, and feel free to contact me if you need further clarification.
Thank you very much to both Natasha and Mariana for two very informative and interesting presentations. Can I ask that attendees give us a moment while we switch over from our pre-recorded content so that both Mariana and Natasha can address the questions that you have been submitting live. And if you could also note that this session will be available on the event platform for the next 3 months. Okay, thank you very much. It's a very interesting presentation. We're going to go into the question and answers section now. We've got more or less 10 minutes until the end of the session. A couple of questions have already been answered, but I think it's also worth repeating those questions so that everybody on the session hears them, if that's okay. So the first question is from Michael, and he asks, do you know which countries that work with creating patient-friendly terms to SNOMED CT concepts? So which countries are working with them?
Well, I have seen a presentation last Tuesday from New Zealand, and there they have 158 patient-friendly terms in Te Reo, and I think they are using them already. I just watched the presentation from Sweden as well, and they are about to release a ref set of chief complaints in November. But I'm not really sure if there are any countries really working with them at the moment.
Okay, hopefully that answers your question, Michael. Stefan, do you add patient-friendly terms as synonyms when translating SNOMED concepts to Dutch, or are those managed separately?
These are managed separately. We have one reference set for Dutch medical language to be used by clinicians, in which we add synonyms. But we also have a different language reference set which contains the patient-friendly terms, so managed separately.
Just to go back to the original question that Michael asked, Pim's offered some more information to say yes, New Zealand, but he thinks also Sweden. If that gives you any more information, Michael. Moving on then to another question. Who decides how patient-friendly a patient-friendly term is? Who makes that decision?
Yes, that is a very difficult issue. We are actually struggling a bit with that. Currently, a colleague of mine is doing a research with different parties, different stakeholders, who all have different interests. And what we're trying to do, what we said, I also said that in our presentation, is we're trying to have every patient-friendly term on a B1 level, so that the majority of the Dutch population can understand the term. And preferably, we would like to have a cohort of patients reviewing those patient-friendly terms to see if they're understandable and recognizable for them. So it's a very subjective thing, but we think that patients patients, actually the civilians, are the end users of these terms. So we think that they have the last say, basically.
Mm-hmm. Okay, good. Thank you. And then finally, how many patient-friendly terms do you have right now?
At the moment, we almost have 3,000 patient-friendly terms. We have 2,892 to be precise. 2,892 SNOMED concepts which have a patient-friendly term. And in some cases, we also include patient-friendly synonyms. So altogether, we have 3,145 synonyms.
Okay, thanks.
Patient-friendly terms, including synonyms.
Yeah.
Thank you.
Yeah, I know what you mean. And then another question that's just come in from Miko. Also in Finland, we have patient-friendly core problem lists in Finnish and Swedish, and that's about 6,200 terms. It's used in, I can't say that number, it's a lot. It's a helpline, at least at the moment. So I think what Miko's adding to the discussion there is that also in Finland, then, that this is something that's being looked into as well and being expanded upon.
That's a lot, 6,200, yeah.
You've got something to aim towards now. Okay, so We've just got a couple of minutes left at the end of this session. We must have a hard finish at the top of the hour. But has anybody got any final questions or comments they'd like to make to Natasha or Marianne? No? Okay, on that note then, we'll complete this session. And thank you very much to the presenters and also to everybody who attended and has asked questions throughout the presentation. Thank you.